Hey, what's up? In this channel we have already discussed how to deal with the sadness and inactivity of an older family member. But depression is more than that. It's a common but severe mood disorder that affects how you feel, how you think, and how you disrupt everyday activities, such as eating, sleeping, or relating to others. And that's why it requires treatment. If the problems with daily life last for several weeks, it is very likely that we are dealing with what doctors call depressive disorder or clinical depression. It is a real disease, not a weakness of the person to cope with his day-to-day, nor a defect of character. You can't get out of depression, but you usually need treatment. It is also often mistakenly thought that depression is part of aging. Well, I don't. Even if it's common, it's not part of your birthday. In fact, the opposite is true. Older people tend to feel satisfied with their lives, despite having more ailments and limitations. However, certain changes, such as the loss of a loved one, retirement, or the diagnosis of a serious illness can cause restlessness, stress, and sadness. Some people are able to regain their emotional balance after a while, but others become depressed. Let's see how to identify the symptoms of depression in older people. It is not always easy to recognize depression in older people, because they may show different symptoms from the rest of the population. For some, sadness is not even the main symptom, but they may have more subtle ones, and be unwilling to talk about their feelings. So even doctors can overlook a depressive syndrome. An older person who is more tired than usual, has trouble sleeping, or is grumpy and irritable may serve as warning signs. On the other hand, the attention problems or confusion caused by depression may resemble those caused by Alzheimer's disease or other brain disorders. Heart disease, stroke or cancer can also cause depressive symptoms. Even certain medications can contribute to its adverse effects on depression. Types of depression. There are several types of depressive disorders. Major depression involves severe symptoms that interfere with the ability to maintain activities such as work, sleep, eat, and ultimately enjoy life. A person may suffer such an episode in his or her life, but it is often repeated. If the depressed mood lasts for 2 years or more, it's a persistent depressive disorder. To establish this diagnosis, symptoms must be present for at least 2 years, although symptoms of major depression may alternate with periods of less severe symptoms. Also worth mentioning is vascular depression, induced by changes in the brain and body sometimes associated with aging. For example, restricting the blood supply of an ischemia can cause vessels to harden, reducing the supply necessary for normal brain function. People with vascular depression will also have an increased risk of heart disease, stroke, or other vascular conditions. There are more types of depression, such as psychotic or seasonal affective disorder, but let's now see what factors contribute to the onset of depression. Causes and risk factors for depression. Let's look at what factors, or a combination of them, contribute to depression. Genes. People with a family history of this disease are more likely to develop it. Personal history. Older people who had an episode of depression in their youth are at increased risk for depression again. Brain chemistry. It is known that there are chemical differences with respect to people who do not suffer from this disease. Stress. The loss of a loved one, enduring difficult relationships, or any other stressful situation can trigger depression. All these factors can coexist with other diseases, such as Parkinson's, cancer, heart disease or diabetes. Depression can make these illnesses worse, and vice versa. And as we've said before, the adverse effects of some prescription drugs to treat those illnesses may even contribute to depression. All of this can cause depression to go undiagnosed or untreated. So be encouraged to talk openly with your doctor, including sensitive or uncomfortable issues, such as those related to sex or mental health. The stakes are high, and so far for today. In the next video we will talk about how to prevent depression and how to treat it. Thank you very much.